Hello everyone, myself Shashikala Wali, working as Assistant Professor, Department of Pharmacy Practice, KL College of Pharmacy, Belagavi. I am going to discuss on COVID-19 present scenario, incidence and prevalence of the COVID-19. So let us discuss one by one. So introduction of this COVID-19, the family of viruses that causes illness such as respiratory diseases. Respiratory disease can range from the common cold to more severe diseases. So examples, Middle East respiratory syndrome, that is called MERS, severe acute respiratory syndrome, that is called SARS. The word corona means it's a crown in a Latin term. So these viruses are zoonotic, which means they can be transmitted between the animals and as well as human beings also. So it has determined that MERS-CoV was transmitted from dromedary camels to humans and SARS-CoV from cats to humans. So what are the clinical presentations of COVID-19? Typically these viruses present with respiratory symptoms. People who become infected and some will be showing asymptomatic also. Symptoms like respiratory symptoms associated with fever, cough, shortness of breath, breathing difficulties, fatigue, generalized weakness, sore throat. So people with more severe symptoms will be going to hospitalized most oftenly with pneumonia also, and in some instances these illnesses can also include the ARDS like sepsis, septic shocks and all. Coming to what are the emergency warning signs are going to include for COVID-19. The patients will be having difficulty breathing, shortness of breath also, persistent pain and pressure in the chest, and they have the more confusion state or inability to arouse, and bluish lips or face will become. And which are the populations are have the higher risk of the COVID-19? There are two groups of people are at higher risk getting severe COVID-19 diseases. One is the geriatric populations more than the 60 years, either 70 years, or maybe chronic conditions like comorbid conditions along with the COVID-19. Maybe it could be diabetes mellitus, either cardiovascular diseases, either chronic respiratory diseases and cancer, hypertension, even chronic liver diseases. Coming to what is the global epidemiological situations of the present scenario. The incidence of new COVID-19 cases has continued to accelerate while the incidence of new deaths has remained relatively stable. So as on 18th October, over 40 million cases and over 1.1 million deaths have been reported globally. So it was a data on 18th October 2020. 2.4 million new cases, 36,000 new deaths reported over the past week. European region has reported rapid increase in cases, deaths for like 9,27,000 new cases past week. A weekly increases of 25% cases compared to the previous week. Number of death continues with 29% from last week. Countries reporting highest number of cases in the past week like India as well as United States of America, France, Brazil and the UK. Coming to what is the COVID-19 situations update worldwide as of 28th October 2020. Since 31st December 2019 and as 28th October 2020, so around these many cases found COVID-19 have been reported, including the deaths also. Cases reported in India 79 lakhs 90,322. Deaths were reported around 1,20,000 so on. So what is the 19th October 2020 reports situations of this? 19th October 2020 Ministry of Health and Family Welfare confirmed the 75 lakhs and 97,000 so on COVID-19 cases, and the deaths were there for 1,15,000 so on. Maharashtra reported the highest cases, followed by Andhra Pradesh, followed by Karnataka, Tamil Nadu, Uttar Pradesh, and the total 60% of cases has been reported. Epidemiologically of this outbreak and pandemic, as of 26 to 2020, confirmed COVID-19 infectious number over 42.9 million individuals worldwide and has resulted 1.1 million deaths. More than 220 countries have reported laboratory confirmed cases of COVID-19 except Antarctica. So, in the United States, over 8.6 million cases of COVID-19 have been confirmed as on October 26, 2020, and resulting over 22 lakhs 4,000 deaths, making it the third leading cause of death after heart disease as well as the cancer patients. So, infection fatality rate are increasing the age of like 19 years of the younger, it could be 0.3, 20 to 49, 40 to 69, and 70 years or older, symptomatically either asymptomatically. Coming to the pediatric populations of COVID-19, American Academy of Pediatrics reports over 7,41,000 children have tested positive in the United States since the onset of the pandemic as of October 15, 2020. This was 13% increases over 2 weeks, represents overall rate of 986 cases per 1 lakh children. So, 1 to 3.6% of total reported hospitalizations, between 0.5 to 7.2% of all child with COVID-19 cases resulted in the hospitalizations. Neonatal fever and late onset neonatal sepsis have been also reported unexpected manifestations of COVID-19 in case reports. Coming to the mode of transmissions of COVID-19. What is the mode? How it is going to spread? So, this disease may spread through large respiratory droplets, either it could be direct, either indirect contact with infected persons. The incubation period of COVID-19 is currently understood to be, it's a 2 to 14 days. So, this means that if a person remains well after 14 days, after being in contact with person with confirmed COVID-19, they are also not infecting. But preventing transmissions of this COVID-19, very important points are: perform hand hygiene frequently with an alcohol based hand rub, avoid touching eyes, nose and mouth, practice respiratory hygiene by coughing or sneezing into bent elbow or tissue, wear medical mask if respiratory symptoms are there, maintain social distancing from the individuals. What are the diagnostic procedures for COVID-19? The gold standard testing for COVID-19, it's a reverse transcription polymerase chain reaction, that is known as RT-PCR. This is the gold standard method. RT-PCR is only 30 to 70% effective for acute infections. This may be due to incorrect use of lab kits, either not enough virus in blood. Followed by chest X-rays are not especially sensitive for COVID-19, but chest CT scan gives much more detailed view in initial stages of the disease. So, what are the differential diagnosis of this COVID-19? Other coronavirus like SARS, MERS, adenovirus, influenza, human metapneumovirus, parainfluenza, respiratory syncytial virus, as well as we call that common cold, rhinovirus, bacterial pneumonia, mycoplasma pneumonia. RT-PCR is the gold standard method. Even antigen antibody testing also can be performed, but compared to antigen antibody, it's a rapid test, it's RT-PCR is the standard method. How to do the sample collections? Preferred samples are throat, either nasal swab in viral transport media and transported in the cold chain. Alternate samples, nasopharyngeal swab mixed with viral transport media transported in cold chain and all. Followed by What are the treatment guidelines for this COVID-19? On October 22nd, 2020, the US FDA has approved the antiviral drugs, that is remdesivir, used in adults and pediatric patients above 12 years of the age and older, weighing at least 40 kgs for the treatment of COVID-19 requiring hospitalizations. And this remdesivir is administered only in hospital care or healthcare settings. And this treatment is received FDA approval. What are the possible side effects of remdesivir? These are like hepatotoxicities are there, allergic reactions, low blood oxygen level can also occur, associated with fever, shortness of breath, wheezing, swellings of lips around eyes, skin and all, rashes, nausea, vomiting, shivering and all. Coming to clinical management of moderate cases of COVID-19. Very important is oxygen support is most important to maintain the SpO2 level 90 to 96%. A device for administering oxygen depends upon the increasing treatment requirement of oxygen therapy. Simple nasal cannula is used. N95 mask should be applied over it. Awake proning may be used as rescue therapy. All patients should daily monitor the ECG, electrocardiogram, CRP, D-dimer, ferritin every 48 to 72 hourly. If available, CBC with differential count can be performed. Lymphocyte count, LFT and all daily it should be monitored. We can add tablet hydrochloroquine, 400 milligram antiviral drugs. It can be given 2 times a day, first day followed by 200 milligram, first BD for 4 days after ECG assessment. Consider the IV intravenous methylprednisolone 0.5 milligram to 1 milligram per kg for 3 days, preferably within 48 hours of admissions or if oxygen treatment requirement is increasing. Coming to the role of anticoagulations of treatment of COVID-19, prophylactic dose of this low molecular weight heparin can be added. Enoxaparin, examples like enoxaparin 40 milligram per day, subcutaneous can be added. Control of comorbid conditions, either COVID with COVID-19 with diabetes mellitus, either hypertension, either any other cardiovascular diseases to be controlled. Monitor for increased work of breathing, hemodynamic instability, increase in oxygen requirement. If any of the above occurs, shift to the dedicated COVID hospital. And it should be monitored. Other further bacterial infections, empiric antibiotic therapy can be added. We should see whether it is a geriatric population is there, immune compromised patients with then we should monitor so anticoagulation therapy can be added. Coming to investigational therapies, remdesivir under emergency used authorizations, moderate conditions we can use it. Dose is 200 milligram IV on day first followed by 100 milligram daily for 5 days. Even convalescent plasma therapy can be added, given, improving the respite of use of steroids. Dose is available ranging from 4 to 13 ml per kg. Tocilizumab in moderate disease patients with increasing oxygen requirements. Dose is 8 milligram per kg given slowly in 100 ml NS normal saline over 1 hour. Dose can be repeated once after 12 hours to 2 hours. If it is required, then only we can give this tocilizumab. Followed by hydroxychloroquine. ECG should be monitored before prescribing the drug. If it is QT interval is correct is there, then we can give it hydroxychloroquine. Dose is 400 milligram twice a day, day 1 followed by 400 milligram daily for next 4 days can be administered, given. Followed by what is the current approaches to COVID-19 therapy. Generally falls into categories. Antivirals can be prevents the virus from multiplying of the virus. Immunomodulators fight the virus or stop it from overreacting dangerously. Antivirals like remdesivir, hydroxychloroquine, lopinavir, favipiravir and imipenem can be given. Immunomodulators like dexamethasone, hydrocortisone, convalescent plasma, tocilizumab, infliximab, adalimumab can be given. Other are multiple mechanisms: colchicine, statins, anticoagulants, omeprazole, vitamin C, that is ascorbic acid, can be given. So these are my references.